name is Melissa. I'll be your nurse today. I'm going to start off with washing my hands. All right, today we're going to be going over and doing a few tests to test your ears, eyes, nose, throat, your lungs, and also your cardiovascular system. So we're going to jump right in, and one of the first things that we are going to go over is your cranial nerve 2, which is your optic nerve, and that's going to be doing a few tests on your eyes. This is a Snellen chart, and most of them are designed to have you stand 20 feet away from them, but this one specifically is designed so that I can stand 6 feet away from you. And what you're going to do is, if you were someone that wore contacts or glasses, I would have you test with them on and then also without them on. But since you don't have any, we're just going to go ahead and test one eye, and then we'll test the other eye. So what I'm going to do is stand 6 feet away from you with the chart, and I'm going to have you go ahead and cover one of your eyes and start at the top line and then just read until you are no longer able to read, okay?
ELTFPHOLCFDHJBSEPTZO OFDHJLTFPH.
All right, perfect. And that is 20/20 vision in that eye, actually. So go ahead and cover the other eye, and we're going to go ahead and try that one.
ELTFPHOLCFDHJBSEPTZO CFDHJ
All right, very close. It's like around the 20/20 to 20/25 range for that eye. And then this one, that was testing your long vision, and then this is your nearsighted vision. And this is the Rosenbaum test, and this one is designed to hold about 14 inches away. So I'm going to have you go ahead and do the same thing and cover one eye, and we'll test that. Go ahead and read the numbers as far down as you can.
Can I just start further down?
Yes, absolutely.
We're gonna go, so I go start here.
Okay.
4, 2, 8, 3, 6, 5.
Perfect.
3, 7, 4, 2, 5, 8.
All right.
And
So probably about the 20, 30.
Yep.
All right, and then go ahead and cover your other eye and do that one.
Here, 4, 2, 8, 3, 6, 5, 3, 7, 4, 2, 5, 8, and 5, 3, 7, 8, 2, 6, 4, 2, 0, 2, 3, 9.
All right, and about 20/20 in that one. All right, so we're going to go over a few of the other cranial nerves. We're going to test cranial nerve 4, 3, 4, and 6, which is the ocular motor nerve, your trochlear nerve, and your abducens. We're going to do the 6 cardinal vision fields, and this is going to be testing just a few different things. What I'm going to be looking for is making sure that as you follow my finger movement, I'm going to do it in a few different locations, and I'll be looking to make sure that there's no abnormal movement of the eye or anything like that. So I'm going to have you just look directly at my finger, and we're going to just kind of go in a pattern, and I'm just watching your eye movement, making sure that there's no abnormalities. All right. I'm also going to check your peripheral vision, and what I'm going to do is just kind of do like a couple fingers at a time, and I want you to just let me know when you see my fingers and how many fingers I'm holding up, whether it's 1, 2, 3. All right, so just go ahead and let me know.
1, 2,
I'm also going to check the reaction of your pupils and make sure that they're equal and round and reactive with this. So just look straight ahead at an object, and I'm just going to have you just keep looking straight ahead. Excellent. And then this one is a cover uncover test, and what I'm going to have you do is hold this over one eye. All right. And as I do this, I'll actually hold it and I'll remove it, and I'm just going to be making sure that there's nothing abnormal. Also with this, I'm going to be looking at your macula and your fovea and your retinal, all of the nerves in here with this. And there's quite a few different things that I'm going to be looking at, making sure that your optic disc is healthy. I'm looking for the red reflex, and I'm going to do that bilaterally. Alright, and then I'm going to go ahead and just palpate around your eyes and just feel all of the different structures, and I'm looking at, as I'm doing this, I'm going to have you look up a little bit. I'm looking at your lacrimal apparatus, your tear ducts here. I'm looking at your conjunctiva, making sure that they're red and just like a nice pink color. Looking at the blood vessels in the eye, and palpating for any tenderness or any abnormalities. I'm also looking at the sclera and the iris and the pupil, just all of the different structures around the eye. I'm also looking at your eyebrows and your eyelashes, and also the lids of your eyes. All right. We're going to go ahead and move on and check cranial nerve 8, which is your vestibular cochlear nerve, or occasionally it's called the auditory nerve. What I'm going to do is just look at the external meatus on both of the ears and just palpate around the ear, making sure that there's no lesions or obvious abnormalities or any tenderness or anything like that. And then we'll look inside of the ear canal with the otoscope, looking at the tympanic membrane and all of the ear canal. All right, and I'll do that bilaterally. And then what we're going to do now is doing the Weber and Rhine tests, which is just checking and making sure that your hearing on both ears is equal and that you can hear really well in both ears. So first we'll start off with the Weber test, which I'll set this right in the middle, and I just want you to hear, or let me know if you can hear it best in your right ear or your left ear, or if it's equal in both ears, okay? All right.
Equal.
All right. and then I'll do that on and make sure and let me know when you can hear this in both of your ears, which area you hear it well in your position A or position B. I'm going to put it next to your ear and then also on a bony prominence behind your ear, okay?
A.
I'll do that behind here.
A.
And then we're going to go ahead and move on to ocular or olfactory nerve, which is cranial nerve 1. And what I'm going to have you do is close your eyes and plug one of your nostrils for me. All right, go ahead and close your eyes. And I'm going to have you tell me what smell you smell when I hold this underneath of your nose, okay?
Cinnamon.
All right. Now go ahead and keep your eyes closed and close the other nostril for me, please.
Vanilla.
All right, you can go ahead and open your eyes. What I'm going to do now is I'm going to be looking at a few more of your cranial nerves. It's going to be cranial nerve 9, 10, and 12. And that is the glossopharyngeal, your vagus nerve, and your hypoglossal nerves. So I'm going to be looking in your mouth and your pharynx and just taking a look at all of the structures in there. I'm going to have you open your mouth wide and say, ah. All right. And I'm just going to kind of move your tongue around a little bit. Another really good test for this, I'm going to have you move your tongue side to side. Another really good test for this is to take a piece of gauze, which I'm not going to do right now, but I would take a piece of gauze and move your tongue from side to side, and that is a really good test just to check things out in here. I'm going to have you go ahead and say, ah. All right, and your uvula is moving really well. Another thing that I'm observing with these cranial nerves would be swallowing, which we aren't going to perform, but I would have you swallow a drink, and I'm listening to your speech, making sure that there's no abnormalities there. Another one that we aren't going to do today is gag reflex, which would just elicit a gag. We're not going to do that one today, but that would be something that we would do to test those cranial nerves. I'm going to move on, and we're going to go ahead and do the lungs and thoracic region. As I've been doing this exam, I've also been looking and making sure that there's no abnormalities. As you're breathing, it's not abnormal. There isn't anything that is very concerning. You have a normal respiration rate. It's been between about 16 to 20, which is very normal for an adult male patient. I am going to do a couple tests. One of them is feeling for tactile fremitus. So I'm going to have you scoot just a little bit forward on the chair. And as we do this, I'm going to have you repeat 99 multiple times as I just feel around on your back, and I'll be feeling for the tactile fremitus. So just go ahead and keep saying 99 over and over.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, excellent. All right, and I'm just going to feel around in this area, just making sure that there's no masses or anything abnormal. And I'm going to have you go ahead and say 99 again 99. As I feel down the front.
99, 99, 99.
All right, good. All right, I'm also going to go ahead and have you sit forward a little bit again. And this test, what I'm going to do is I'm going to end up having you take a deep breath and blow everything out and then hold it. And I am going to just percuss down your back as quickly as I can. And I'm going to be testing to make sure that everything is normal, okay? So go ahead and take a deep breath and then blow it all out. And then hold. All right. And I'm just going to go ahead and mark here. All right. Now what I'm going to have you do is go ahead and take a deep breath and hold, okay? Excellent. Go ahead and breathe. And I'm going to go ahead and measure this, and I'm going to make sure that it is excellent. It is about 5 centimeters, which is normal. 3 to 5 centimeters is a normal range. All right. Now I'm going to go ahead and just auscultate your lungs right now and listen. Go ahead and take a deep breath. And a deep breath again. And again. Excellent. All right, and we're going to do this side. All right, and one more time. All right. And then what I would do for a full assessment is make sure and listen to the entire anterior side, lateral side, and then I had already checked the posterior side. Right now I'm going to go ahead and listen to a few of your heart valves. And this first one is going to be in your second right intercostal space. So what I would do is kind of just come down right in about here. And you can just go ahead and breathe regularly. And I'm listening to your aortic valve right now. And then I'd move over to the left second intercostal space. And that is your pulmonary valve that I'm listening to. Then I'd move down to the third and listen to Erb's point. And then move down to the fourth and listen to the tricuspid. And then move over to the fifth and listen to the mitral valve. Now I'm going to go ahead and check a few of your pulses. We'll start with your temporal pulse. And then we'll palpate your brachial pulses. And then your radial. All right, and these ones I would do bilaterally, but I'm just going to go ahead and demonstrate on this side. I need to palpate your popliteal pulses. I would palpate your dorsalis pedis pulses, which are here, and then your posterior tibial, which are back here. All right, and that is everything for today.